Hi everyone, welcome again. In this video, I'm going to walk you through the Palmar grasp reflex. And I'm thinking that you already watched the first one on the Moro Reflex. If not, go back and watch that one on the Moro Reflex. This is the second video that I'm recording for you so you can have a basic understanding of what Palmar grasp reflex is and what its benefits and the signs and symptoms when this reflex is still present in a child's body. So I'm going to share my screen here with you so you can follow along. Okay, here is the Palmar grasp reflex pattern. When you put a finger in the palms of the baby or the infant right away grasps really hard. You can see in this image, and you can even see his hand, like how hard he's grabbing it. This is a reflex, not the child's ability to grab or its strength, but a reflex pattern that is present. And this stage, you can even lift the baby up because the baby's grabbing it so hard. So you can see how strong these reflexes are. You might not see other reflexes acting as strongly as the Palmar reflex, because with the Palmar reflex, you see them grabbing. With other reflexes, you just see them reacting. And if you don't know that pattern, you don't even see whether or not that reflex is present. But it's easy to explain. In my experience, it's easier to explain with Palmar reflex to see how strong these patterns can be. So what is the sensory stimuli? When we say sensory stimuli, like what needs to happen for this reflex to react, okay? So the sensory stimuli is touch or stroke of the palm at the base of the hand, and the Palmar reflex response will be finger closing into a firm grasp. What are the benefits of the Palmar reflex? The benefits of the Palmar reflex includes the baby being able to reach and grabbing objects, holding on to mom, holding on to a bottle, being able to hold and consistently hold onto something in order to pull. Fine motor skills. We need the Palmar reflex for fine motor skills, manual dexterity, for writing, drawing, typing, coloring. Helps with binocular vision. That's the ability to use both eyes, and depth perception. That's the ability to not that the Palmar reflex is giving that skill, but the hand and the eye coordination working together and helping the baby understand the distance between the hand and the object. And when they touch it and when they manipulate, they learn to have depth perception. And again, with the eye-hand coordination, for ability for self-care skills, for dressing, for grooming, feeding self, for auditory discrimination, which helps the right and left side discrimination, being able for the child, for instance, hears a toy, or like a music or something on one side, the baby will be able to turn to one side and try to reach and hold on to that object and kind of start the perception, the body, and how do I explain it? Like the auditory and the vision, the combination of, and this distance between self from object, all of that kind of comes together. And with all that, the Palmar reflex also plays a part. And the signs and symptoms of retained Palmar reflex. On the other video, we talked about what I believe we talked about what retained reflexes are. Retained reflexes is when these primitive reflexes are present for duration amount of time. With this and with Palmar reflex, it should be present to about like 3 to 4 months, but afterwards we need to see it become dormant and not as active. So if I touch, let's say a 4 or 5 months old baby, if I stroke their hand, I don't want to see them grabbing me and their Palmar reflex being active. If that is the case, and it's going to affect their functional skills and their development. So that means that they're not able to move their hands independently of the reflex. So when we say a retained Palmar reflex, we're saying that these this reflex is active in the child's body, and the child is not able to move his or her hand independently of these reflex. So the signs and symptoms, what we see when a palmar reflex is retained, we see poor fine motor control, poor fine motor dexterity, poor eye-hand coordination, because this reflex is present and not allowing the child to move the hands independently, and poor pencil grasp. We see a premature fisted pencil grasp, the child not be able to gradually move through the progression of the fine motor milestones. You see fatigue because the reflex it's very strong, and the child is going to hold it, the pencil, the crayon, whatever they're holding very tightly, or they have to accommodate so much. You see them a lot of tension, a lot of cramping of hands. You see them even shrugging their shoulder. They're really working really hard. You might also see motor overflow, like their tongue is moving, the facial grimacing. They're working really, really hard to do a very simple activity. They'll have poor visual perception. They'll have poor binocular vision, poor depth perception, and poor eye-hand coordination. Here, I have a quick figure for you to see the developmental progression of pencil grasp. Most of the time when we have students get referred to the occupational therapy because they can't keep up in the school. It can't keep up with handwriting, can't keep up with the classwork. And if the palmar reflex is present, they even have a difficulty with writing skills and fine motor skills. And in this video, in this picture, and what I want you to see is the progression of the pencil grasp, okay? So we want to see this progression. We don't want to hurry up the kids to be able to hold the pencil, let's say, and tripod grasp like a 4.5, and like about 5 or 6 year olds. We will expect them to hold a pencil with a tripod grasp, but the natural progression will look like this. So if when the child is 1 and 1.5 year old, we will encourage them. We will not discourage them to holding their. We will not discourage them to hold the pencil with the cylindrical grasp. So that kind of grasp, we will continue to encourage them and let them explore. We're not fixing it because this is where the developmental stage is at. By 2 to 3 years old, you see this digital grasp, like they will hold their pencil with their fingers. That is fine. And by 3.5, 4 years old, or 4.5, they start modifying grasp hold. And we don't want to force them into a tripod grasp because their hand is not developed yet, and it's okay for the child to continue to have this kind of hold. I'm showing you here because I know most of the time, most of our kids are presented with like paper, crayons, and pencils at a young age, right? So they're forced into holding the pencil, the crayon in a very mature way when they're not ready for it. So I wanted to encourage you to not force them into it until they're ready. By let's say by 6 or 7 year old, when the child, or 5, let's say, run for a 5-year-old, when a child is not able to do a lot of functional fine motor activities and can't even hold the pencil correctly in order to write, then you wanted to address it. Until then, you want to go through this developmental stage and continue to encourage them. So I just want to give you that tip there, because most of the time, SOTs, we see a lot of times kids being forced into holding it in preschool when they're not ready to hold their pencil. Okay, so this will be a quick cheat sheet for you. Again, another signs and symptoms of retained palmar reflex will cause includes posture and poor postural control during tabletop activity, mainly in handwriting and copying skills. These are something that you're going to see. You will see speech and language delays, speech is a fine motor skill, and usually when the Palmar reflex is retained, we tend to see speech delays as well. So if your child has a speech delay, definitely talk to a speech pathologist and specialist. But keep in mind that usually speech and fine motor skills tend to go hand in hand. Other signs we also see is several movement overflow during, especially when we co-treat and we work with speech therapists. We see kids with retained palmar reflex when they're working on their hand and trying to cut or write. You see their mouth are still moving, their tongue is also moving, and you see how that reflex is affecting their oral motor and their tongue, which is related obviously with speech. So we see that happening together. So definitely something for you to consider as you're looking for treatment for your child, to look into like the palmar reflex and the speech development. It will affect difficulty putting thoughts on paper, dysgraphia, and that's another area that we see how palmar reflex affects some of our children, and difficulty with self-care skills, which requires fine motor coordination. In the next video, I will talk about the rooting reflex, which also affects our speech and oral speech development and oral motor development. There are other primitive reflexes that also affect speech development and fine motor skills. So in order to be notified, make sure to subscribe to this channel, and then you'll be notified when the new one comes out. I hope this is giving you an idea, basic understanding of what palmar reflex is and how you can identify some retained primitive reflexes in your child's body. Let me know how this is helping you, and if you have any questions, feel free to ask and put your questions below. See you next time.